Hey guys, my name is Dr. Abdul Khan. I'm the Vice President of Medical Affairs at St. Bernard Parish Hospital. I'm also a pulmonary critical care physician at Oxford Health Center. I wanted to talk to everybody about vaccines and making sure that St. Bernard Parish, that all the residents of St. Bernard Parish are trying to get their vaccines. To give you a little bit of background information, guys, we've been taking care of COVID patients for the last year now, and we finally see the surges that we've seen, stabilize and patients in the hospital who have COVID decrease. A large part of that is us getting the vaccine and making sure that everyone else around us is getting the vaccine. Important for us to know, Region 1 of the Louisiana Department of Health is Orleans Parish, Jefferson Parish, St. Bernard Parish, and Plaquemines Parish. We're actually number one in the state of Louisiana as far as percentage of patients and people and residents getting the vaccine. 25% of the residents of Region 1 have already been vaccinated. Of the region itself, though, St. Bernard Parish is a little behind. We're at 15%. So we're, the least vaccinated parish in our region. And so we need to get the word out so our residents are getting vaccinated. I think it's important for us to talk about the vaccine itself and dispel some of the myths. St. Bernard Parish Hospital has given over 10,000 vaccines already. So there's a lot of people in the parish who are getting protected. In our hospital system, over 80% of the doctors, so over 80% of the doctors in our health system have already gotten the vaccine. So people who know the information, who are working every day, are getting vaccinated. And I want that to translate to the residents of St. Bernard Parish. Yes, so 25% of Region 1 has received the vaccine, and 15% of St. Bernard Parish has received the vaccine. So 15% has been fully vaccinated, has received both doses of the Pfizer or Moderna vaccine and or the Johnson & Johnson vaccine. So it's 15% of St. Bernard Parish is fully vaccinated. And what's important to know, I think this is important for everyone to know, is which vaccine is the best vaccine for you. It's the first vaccine that you get. And that's the important point to know, is that people who are getting vaccinated are not getting very, very sick. If they get COVID-19, which is in it itself is rare, they're getting mild symptoms of COVID-19. And so it's important to know that getting vaccinated, the vaccine you should get is the first vaccine that you're offered. No, the AstraZeneca vaccine is not FDA approved in the United States. So we know that if you're 16 and up, that between 16 and 18, that you can get the Pfizer vaccine. And there's plenty of vaccine available. To give you an idea, over 100 million Americans have already gotten at least the first dose of the vaccine. So, it's important for us to know that this is the best way for us to get through the pandemic quickly. There's worry that we developed this vaccine too quickly. It's important to know that there have been vaccines in the past, like when H1N1 happened, where vaccines were developed quickly. They were done safely here. Part of the reason why, Pfizer and Moderna were approved first, so that you could have a rigorous test of trials on volunteers to make sure that it's safe. And AstraZeneca is not one of those vaccines here in the United States that has gone through the rigorous process, yes, to be approved. And that's part of the reason why it's important to know that the FDA is working hard to keep everyone safe and making sure that the vaccines, they're 100% safe when they're rolled out. And I think even more important is for us to know is these vaccines have now been out. I received my first dose in December, my second dose in January. And so these vaccines have been out for the general public in some sense for over 3 months and in trials for close to 6 months. And so we have a good idea of the side effect profile of these vaccines. And, there's limited, information about people actually getting very sick from the vaccine, almost unheard of. And so that's probably the most important thing to know about the vaccine is the major side effects are, almost zero. And just as important is how effective this vaccine has been. You know, basically zero as far as severe COVID-19 disease associated with patients who've been fully vaccinated. No, that's the short answer. The detailed answer is that this isn't a live virus. Only the information that's needed for our body to increase our immune system to help fight the virus is all that is in the vaccine itself. So, can a COVID-19 vaccine make me sick with COVID-19? Absolutely not. It gives you the information so your body fights the virus. Yes, you can have some mild side effects from the vaccine when you take it, but it's important to know that this is your body revving up its immune system to help fight future infections and getting that immunity so that you can fight COVID-19 if you're exposed to it. Sure. So, the short answer is that when you get a vaccine, you do get mild side effects. And those side effects are your body building immunity to the vaccine itself. And the common side effects of the COVID-19 vaccine are mild headaches, pain at the injection site, fever for the first 24, 48 hours. And those are all signs that your body is building immunity against COVID-19. No, none of the studies have shown that someone who gets the vaccine actually tests positive for COVID-19. So it doesn't affect that. It only gives you and your body the genetic material to help boost your immune system. Yes, you should. The reason being is we don't know how long immunity lasts. What we do know is the vaccine is the safest way for us to build immunity. So getting the COVID-19 vaccine is the safest way for our body to build immunity to the COVID-19 virus. This is an important issue that affects every one of us, our families and starting families and the residents of St. Bernard Parish. It's important to know that vaccines generally, when they're rolled out, side effects are seen in the first several months of the vaccine. And now the vaccine's been out for over 6 months, including the trials. There has been no information that has linked the COVID-19 vaccine to infertility. The answer is yes. All of the national organizations, ACOG, the American College of Obstetrics and Gynecology, the Society of Maternal Fetal Medicine, and the American Society of Reproductive Medicine have released a joint statement saying that it's safe for women that are fertile to get the vaccine. So the big question and the big misconception out there is, will COVID-19 affect fertility? And that's absolutely false. There isn't any data or information. And what's important to know is a lot of times pregnant patients are not included in trials. But a lot of the trials, people did get pregnant during the trial itself. And now the information, we have a good chunk of information for the last 6 months, and there hasn't been any issues with fertility. So it's important for everyone, our young females in the community and the residents of St. Bernard Parish, to know that fertility is not affected by the vaccine. And it's important for all of us to make sure that we're doing our part. Lastly, I'd like to finish with this, is we're still seeing sick patients. The trend of sick patients has gone down significantly. But as a critical care physician working in the intensive care unit, we still are admitting patients who are very sick with COVID-19. And there's patients of all ages who have been admitted. We have young patients and we have elderly patients. And so this is a disease that can affect anyone. It's a responsibility for everyone here, for everyone in St. Bernard Parish, to do their part to protect our families and make sure that we can get over this pandemic. All of us want to live in a world where we're not wearing masks, where we're walking around freely, where we're not afraid that the virus will affect us and our families. And a lot of us in St. Bernard Parish have been affected by COVID-19, and all of us know someone who's been sick with the virus. This is the best way for us to build immunity and to get through the pandemic. So I'd just like to request everyone in St. Bernard Parish, please, come to St. Bernard Parish Hospital, go to our other testing sites, make sure you get yourself vaccinated.